Hello, welcome to Boston Bone and Joint Institute. If you're watching this video, you may have a few questions about your Iceman Classic 3 cold therapy system. This is the Iceman Classic cold therapy system by DonJoy. There are many alternative brands and models available online that will help you achieve the same goal, but this is the brand and specific unit we prefer. Unfortunately, commercial insurance companies do not cover these items, and there will be out-of-pocket costs involved. Boston Bone and Joint Institute collects payment for this specific item or can be purchased through your provider's recovery shop website. Please contact our office for additional information on how to obtain one. The goal of this device is to control localized pain and swelling of both limbs and joints. This device is indicated when ice is a recommended treatment option for traumatic injuries, as well as before and after surgical procedures. Some examples include rotator cuff repair, ACL reconstruction, and total joint replacements. This device only provides cold therapy and has no compression associated with it. The purpose of a cold therapy device is to make icing more convenient, and patients often feel this is easier and more comfortable to use than bags of ice or reusable ice packs. There are many other units that provide compression, but this specific device does not. This device is not indicated for use on patients with hypersensitivity to cold, Raynaud's phenomenon, poor circulation, and with certain skin conditions. Please discuss with your provider if this device is indicated for you. To set up the device, first unlock the device by rotating the handle forward. Remove the lid, then fill with ice cubes and water to the max line as shown here. For longer temperature control, we find it's helpful to use larger ice cubes or frozen disposable water bottles. Replace the lid, press down, then rotate the handle back to lock the top onto the water tank. Attach the desired pad to the hose. You should hear this click into place. Next, attach the power supply to the port found here on the unit. At this time, you are now ready to attach the pad to the body part being treated. Please be sure to have a protective barrier between the pad being applied and your skin, such as a t-shirt or a thin towel. Never place the pad directly on the skin, as this may cause irritation or burns. We have two different pad types available, the universal pad and the shoulder pad. To apply the universal pad, place over the body part being treated. Please note the smooth side should be touching your skin, and the softer gray side should be facing outwards. Here, we're applying it to the knee joint, but it can be used for many other areas of the body. Now, secure the pad with the straps provided. Next, remove the protective caps and attach the pad to the hose that is connected to the reservoir. You will hear and feel them click together into place. Next, plug the power supply into the wall. This will automatically turn the machine on. To apply the shoulder pad, place over the injured shoulder. Please note the smooth side should be closer to the body, and the softer gray side should be facing outwards. The shoulder pad can be used on either shoulder. Both the pad and the straps are numbered 1 through 3. Attach the straps in the following order. The first strap will go around the patient's torso. The second will surround the bicep, and the third will attach under the armpit. Now remove the protective caps and attach the pad to the hose that is connected to the reservoir. You will hear and feel the two click together into place. The pad should be fastened on the shoulder as shown here. This comes in both a small and large size. You may find it helpful to have assistance when fastening the pad. For proper use of the Iceman, make sure the following is done before use. Ensure the water used is cool in temperature. Replenish ice after each use. Place the unit on a stable surface. Have a barrier between your skin and the pad to avoid irritation and burns. Always unplug the machine after use. Your provider will discuss with you the frequency and length of time you will want to use this device. Using this device more frequently the first few days after surgery may make your recovery more comfortable, as it can help control your pain and reduce your swelling. Make sure your skin is warmed to room temperature before your next icing session. After each session, check the skin for irritation. It is not advised to sleep with the pad on. To properly store your ice machine, unplug the power supply, detach the pad from the hose, unlock and remove the lid, and drain the unit. Be sure to dry the inside of the unit thoroughly with a towel. To properly drain the pad, hold the pad so the hose is hanging downward, allowing as much water as possible to escape through the end of the hose. Your unit is now ready to be stored until your next use. Between uses, be sure to inspect all parts of the machine, looking for cracks in the hose or tears in the pad. Contact our office or reach out to the manufacturer if you have questions regarding machine or pad replacements. If you have additional questions regarding your cold therapy system, please refer to your post-operative protocol, discuss with your physical therapist, or contact our office by phone or message through the BBJI portal to speak to a certified athletic trainer.